We are just going to talk about the new classification system that was devised in 2018, and it talked about the updates that were made when we think about classifying the periodontal conditions of a dental patient. New classification system involves classifying the condition into stage, extent, and progression with anticipated treatment response. When we talk about stage, it is classified into stage 1, 2, and 3. Extent means seeing the condition whether it is localized or generalized, and progression means if the condition is having a slow onset or rapid onset or rapid progression, or it has a moderate progression. When we talk about staging of periodontitis, it involves stage 1 that will include attachment loss of 1 to 2 millimeter, and there is less than 15% of the bone loss around the root of the teeth, and no teeth has been seen to be lost because of this periodontal condition. One can expect to see probing depth of 4 millimeter or less with mostly horizontal bone loss. This will classify the condition into stage 1. Stage 2 involves clinical attachment loss of 3 to 4 millimeter and up to 33% of bone loss. There could be seen some probing depth of 5 millimeter or less. So up to 5 millimeter brings the condition into stage 2. Stage 3 involves 5 millimeter or more attachment loss with bone loss that is beyond 33%. One can expect to see a tooth loss of more than 4 teeth. There could be some periodontal depth deficit seen with 6 millimeter or more in some areas of the mouth, and vertical bone loss could be expected here in this stage. Stage 4 involves everything that we have talked about in stage 3. Excessive clinical attachment loss, excessive bone loss more than 33%, and furcation defects, and along with that there are some additional complex factors that could be seen. One might see that the bite has been collapsed, there could be occlusal trauma, there could be shifting of the teeth, which means that due to loosening of the teeth they are tending to migrate, move away from each other, and there are less than 20 remaining teeth in the oral cavity. All these factors, considering everything into the view, it will bring the condition into the stage 4 of periodontitis. Then we talk about extent of periodontitis. It could be localized when the bone loss is around less than 30% of the teeth in the mouth. When the number of teeth increases, which means the periodontitis is seen in more than 30% of the teeth in mouth, brings this condition into a generalized form, which means that now the condition has become generalized as a lot more of the teeth have been affected. For grading of periodontitis, we have to measure if the condition is having a slow progression, moderate progression, and rapid progression, and that can be determined over a period of time if we are seeing any bone loss or clinical attachment loss over a period. If a person is having no bone loss, is seen to have no clinical attachment loss over a period of 5 years, despite that person having a heavy plaque buildup, means that the condition has a very slow progression. Now we will take into account also if the patient is a smoker or a diabetic. Grade B or moderate progression, when we see that there is some bone loss less than 2 millimeter and less than 2 millimeter clinical attachment loss over a period of 5 years, and the patient could be smoking half pack or less per day. And if the person is diabetic, seems to have a blood glucose concentration of less than 7%, and the amount of destruction that is seen, it commensurates with the amount of plaque that is present, will bring this condition into grade B as it is progressing moderately. Grade C involves rapid progression where there is a high level of bone loss and more than 2 millimeter of clinical attachment loss is seen over a period of 5 years. The patient smokes a lot, more than half a pack a day, or has a high blood glucose concentration, and destruction exceeds the amount of biofilm. This will bring this into grade C or rapid progression category. To sum up here, just think about describing the condition into stages and extent, if it is localized or generalized, or if it is slow progressive disease or a moderate or a rapidly progressive disease, will bring everything that we need to know about this new classification system into our knowledge, and we can use it regularly in our dental practice. I'm Rahul Monga, and thanks for watching this video.